clearly isn't enough to get ahead of this problem. And so that's often what's called supply side drug enforcement. And I think what people need to begin to focus on is the demand side. Like, why is it that, 18 to 25-year-olds is one of the fastest growing group of heroin users in the country right now? Or why is it that middle-aged people are just going to their doctors and seeking painkillers? Like, why are we in so much pain? And I think that's the question, the much more complicated question that we need to get to the root of. And I think there's a lot of answers to that and a lot of good policies that could address that. So I think first off, if we frame this as an overdose crisis, the best policies out there would be ones that prevent overdoses. And so that's like getting naloxone or Narcan in the hands of everybody. Like, it should be in every first aid kit, like an EpiPen. And we're not doing that yet. I mean, every single house should have this, as though it's like someone in the house has a peanut allergy. It's just like, get this so you can reverse an overdose. That's like the first thing. Mm-hmm. But that's also a Band-Aid. Like, we can't just, Narcan our way out of this problem. So other policies are like more on the harm reduction side of things. So people need access to sterile instruments to inject their drugs. Otherwise, the healthcare community spends so much more money on soft tissue infections and so much more money treating hepatitis C and HIV. And all this money is being spent on preventable illnesses. So we need to be putting money in places that will, at baseline, keep people alive and reduce harm. And some other policies we could be talking about, I don't know if this would really work in like a rural setting, but Canada and Western Europe, they have implemented what's called a supervised injection site. And these sound very controversial, but all it does is give someone a safe place to use their drugs. So in the event of an overdose, they aren't alone and they don't die. And then also at these places, what you're really doing is giving services to a very hard to reach population that has probably been shunned by the medical community at some point in their life. So if you set up places for people to go to be safe and not be judged, then you can start linking them to social services and treatment and a variety of other services that can start to address the harms of just using drugs in the first place and hopefully transition to a safer, better way of living.
Mm-hmm. Well, and it seems like what this administration is doing is in many ways sort of the opposite of the types of things that might reverse some of this. So when you're talking about demand side, the thing that pops into my mind immediately is if we had universal mental health care, that is something that would make a real measurable difference. And that's clearly not something, they're going the opposite direction with the type of ACA repeal that they're talking about. And so it's, it's troubling in a number of ways, of course, but it's mind-boggling that you see Trump saying that there's an opioid epidemic and he declared it a health crisis or a national emergency. I don't remember which is which.
Yeah, it's like a public health emergency, which has effectively done nothing. It didn't open up any new money. It didn't expand access to treatment. All it has done is like moved around some like bureaucratic barriers. And I think the total fund that was left in the disaster relief money that this emergency would tap into was like $57,000, which is like less than $1 per fatal overdose victim. Like, we need tens of billions of dollars to address this.
And so I think it was set for 90 days, that it was going to be for the next 90 days. And I think we're right about at 90 days. And I was just reading that they had just decided to put an extension on it. So, instead of saying, here's what we've accomplished in the 90 days, instead we're saying, let's just say it's going to last longer and still do very little.
Yeah, and it's mind-boggling, you're right, because this is like one of the only bipartisan issues left in this country.
Mm-hmm.
Democrats and Republicans both want to do something about this. And I don't get why they haven't. Like, what is preventing them from just pouring money into mental health, pouring money into addiction treatment, and pouring money into harm reduction services that will actually reverse the death curve? I mean, France, they were in the middle of a raging HIV and heroin epidemic not that long ago. And what they did was they instituted what's called a low threshold model for accessing medications like methadone and buprenorphine. And within, I want to say less than 10 years, their overdose rate dropped by 80% just because they made treatment access way easier to get than heroin. Like, you need to make the treatment easier to get than the drugs on the street. Otherwise, what's the incentive? Like, why would I go through all this time and money and complicated work to get treatment when I could just go walk down the corner and get my fix?
So one of the reasons I think that we have so much trouble in this country putting forth bipartisan efforts to help combat addiction is because there's such a stigma around addiction, because it's often still seen even today as like a character flaw or some sort of moral failing instead of an actual illness. I'm wondering if you have any suggestions for like concrete ways that we can work to decrease that stigma.
Yeah, I mean, that's so hard. And I do think stigma is probably one of the most important factors in why there hasn't been a robust federal response to this. I think, I mean, there are a number of ways to start reducing stigma, and I think one of them has to start with the recovery community and people who use drugs and people who don't use drugs anymore, to just be out there and be like, hey, I mean, I had a drug addiction and I got help, and now I have a family and I have kids and I have a life. And that's sort of what I try to do in my writing is I talk about my own experience and talk about my own recovery and say that, like, I'm a writer for a living and I'm doing the thing that I love, and your life isn't doomed if you struggle with a drug addiction. And I think the more people are out there, the more people are talking about it, then the more people will be, the more their assumptions will be challenged about what it means to have a drug addiction. And, I think a lot about parallels to the HIV epidemic. And, in the beginning, that primarily affected, or so we thought, gay men. And it turns out that, no, this happens to all of us. It's not just the other who gets HIV. And slowly, research began to, really, really help people who have HIV, and now they live long, productive lives. And I think the recovery community and people with addiction really need to start a sort of act up mobilization and movement to really get out there and advocate for their needs. But there is still such a stigma. I mean, if you have a job and you go to a march that's advocating for addiction, I mean, are people going to be like, oh, you're a drug user, you're a drug addict, what are you doing? We can't trust you as a teacher or a nanny or whatever. So there's so many barriers to forming a movement that we still need to get over. Yeah, I think, there's just so much misinformation about what addiction is. I mean, the clinical definition of addiction is using drugs compulsively despite negative consequences. And if we really took that up as a real definition, our policies wouldn't punish people who have addiction, because we would know that the consequences don't fix it. All we do is punish people who have this problem and think we can stop them from using drugs. But if addiction responded to those types of punishments, we wouldn't have it in the first place.
I was just going to say, one of the things I really loved about your piece in Slate about activists was the part where you talked about how there are so many people who are in recovery that sort of defy this stereotype, the addict. And you talk about a study that had found that a really big proportion of people who have resolved addiction didn't use formal treatment or develop what I think you called a recovery identity.
Mm-hmm. Yeah.
And that's really useful because that applies to my husband. He is an alcoholic, but he didn't go to inpatient rehab or anything. He just started going to therapy on his own just because he realized that he had a problem. But he is a person who could be speaking up about addiction, but there's a lot of ways in which people don't consider him like a real case of addiction because he didn't, have any sort of moment where he like destroyed his life or anything. I think that was a really useful point because there's a lot of people out there that have suffered from addiction, but you might not necessarily know it.
Yeah, totally. And I think like media has a big part in perpetuating the most dramatic, the most harsh, the most intense form of addiction. And we can thank like A&E's intervention for that one. I mean, the only thing people see on TV when addiction is around or mentioned is like hardcore drug use. And it's actually, that turns out to be a minority of cases. It turns out a lot of people have some kind of problem with substances. Maybe they drink too much. Maybe they smoke too much pot. Like who knows what it is, but not every single case of addiction leads to losing your kids, losing your wife, losing your family, losing your house. I mean, it's on a spectrum, and I think we need to take that into consideration when we're talking about this condition, is not everyone has the same experience.
Well, and I think having some sort of deeper understanding about addiction in general and what it can mean, I think would be helpful to everybody. There have been times in my life, especially when I've been dealing with depression or more recently anxiety, where I have started to fall into somewhat addictive patterns. And so in my case, it hasn't meant anything like drugs, but there have been times in my life where I have started to lean on alcohol, a little bit more than I should, or, even things like eating in unhealthy ways, and it hasn't, in my case, very often gotten to the point where I've thought, whoa, this is a real crisis moment. But even sort of understanding how those sorts of things start to happen, and I think they start to happen at least in a very small scale way to everybody. And so in some cases, you sort of identify the problem and can move past it. In some cases, there's something deeper going on. But I think if we just in general had a much more open conversation in this country about what those sorts of habits look like and the kinds of things that you do in your life that are unhealthy. And sometimes those things have to do with chemical signals in your brain, and sometimes they have to do with situational things that are going on. But, if people started to realize that, no, really, this is something that everybody could be facing at some point, then some of that stigma might start to go away a little bit.
Yeah, I mean, I totally agree. And it really gets back to the demand side of this whole equation we've been talking about. It's like getting back to the question of, why are we in pain? Or why do we go to a chemical for comfort or sort of like a warm feeling of connection? And I want to say it's because we're not getting it elsewhere. I think we live in a very hyper-individualized, technologically driven, atomized society. And I think people feel alone. And I think if people had others to lean on, or a more robust community, or even just, like you were saying, like a more open dialogue about emotional pain or just general isolation, like all these things, I think we all feel increasingly more, and it's just not being addressed. It's not being talked about. What we do is we just look at our phone or we scroll listlessly through our feeds. I mean, I truly think that there's something deep